Hi, I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville. Welcome to this week's edition of Kibbitzing with Kagan, brief conversations with people I find fascinating. Today's very special guest is Karen Nelson, the president and CEO of Planned Parenthood of Maryland. Karen, thank you for what you do, and thank you for taking time out to chat this morning.
Oh, thank you so much, Senator, for having me and, for all of your support in what Planned Parenthood does, everything you do for women, everything you do for everyone in the state of Maryland.
You're very sweet. Thank you. We have a lot to discuss today, and I kind of want to go straight to it, but I want a bit of your background. You joined us in Maryland after being in Central and Western New York in Planned Parenthood. But before that, how did you get started in abortion rights? How did you first connect to the issue?
Oh my gosh, I feel like my world has come full circle. The first time, well, I was a Planned Parenthood patient. I should back all the way up. I was a Planned Parenthood patient as a teenager, like so many people in the United States, 1 in 5
Yep.
women have
Yep.
visited Planned Parenthood. And in 1992, I had recently graduated from college, and we had a little bit of some activity in the Maryland General Assembly, a little something called Question 6,
Yep.
which
Remember.
uh, which put abortion care into the state statute. And I just was interested and became a little bit of an activist. And I was living in College Park, drove up to Baltimore, went to the Planned Parenthood there, and became kind of the local captain for College Park. Got the signs up, did my honking waves. That was my first dabble into
Wow.
politics, my
Yeah.
first dabble into Planned Parenthood, and it really got me hooked.
Amazing. So then you became a professional and
Yes.
talk through the journey. So the politics of College Park and of Maryland is a lot different from Central and Western New York.
Oh, absolutely. Absolutely. We had an opportunity. My partner, Scott, had an opportunity in Western New York. I followed him up there, but I didn't follow him until I had a job that I wanted to pursue, and that was with Planned Parenthood. So I
Amazing.
started at the Western New York Planned Parenthood. And although politics are different, you know what's not different? Healthcare.
Yeah.
So the same healthcare that was being provided down here in Maryland was being provided up in Buffalo, New York. And, yes, Western New York politics are a little bit different, but we still have tons of people in Western New York that care about women's rights and care about abortion rights and want to make sure that folks are healthy. So I got to spend a little bit of time up there learning about Planned Parenthood, learning about healthcare, built a little career around it. But when the job for the CEO of Planned Parenthood of Maryland came open, I jumped at it to come back.
So I'm going to correct you. Building a little career, I think that's, come on, come on. Women talk down about their stuff so too much. Come on, you're better than that. Um, so you came down here and we grew up Roe v. Wade and
Mm,
abortion rights were legal.
yep.
We just had on June 24th of 2022, the Supreme Court released their Dobbs decision after it had been leaked. What
Mhm.
had you prepared for, and how was it different or the same as what you expected?
Yeah. Well, as you know, and like I just talked about, for 30 years, abortion has been in the state statute here in Maryland. So we
Yeah.
felt like, okay, we're going to continue to be able to provide abortion care here, but how is it going to impact us when Dobbs hits? So the first thing that we were doing in preparation was looking the Abortion Care Access Act, which was passed last year by the Maryland General Assembly. It expanded the number of providers that can provide care. And it provided for Medicaid and insurance to ensure that patients who used those insurance methods would be treated the same as if they were using any other healthcare, or they were receiving any other healthcare.
So let's
And
talk specifically, if you would, because I was going to get to 2022. Talk about who can now in Maryland perform abortions.
Sure.
and how they're
In
trained.
Yes, I will be happy to do so. So in Maryland, physicians, as well as because of the Abortion Care Access Act, physician assistants, certified nurse midwives, and nurse practitioners can now also provide a procedural abortion. So, abortion can be provided in two methods. One is by procedure, and the second is by medication. And now all of those providers are able to provide the care here in Maryland. And it upped the number of providers exponentially immediately. And we're going to be able to train even more providers because part of the Abortion Care Access Act ensured that $3.5 million would go into a state training program.
Yes.
And as you know, our new governor released those training funds on day one on the job. So those funds are now available and being utilized by the Department of Health to determine what the training program looks like.
And let's be clear, there's so many people who thought that Governor Larry Hogan, former Governor Larry Hogan, was moderate and all that, but he withheld the funding that we had set aside for women's health care, reproductive health care. And now, as you said, Governor Westmore, day one, he is very pro-choice and very much of an ally. Let's talk for a moment about medication abortion, because that has become a big issue. So RU486, Plan B, the morning after pill, whatever it is that is called now, that is what a lot of women, a lot of young women especially, find especially convenient. Why don't you talk about that?
Okay, so two things just to clarify. Plan B is emergency contraception. It is not the abortion pill. The abortion pill is mifepristone. And that is what you're hearing about in the news right now, because there was a group of anti-choice folks who have sued the FDA in a court in Texas. And what they are alleging is that the FDA in the year 2020 did not appropriately approve the usage of mifepristone and did not appropriately approve, authorize that pill. This is a pill that we've been using in medication abortion for over 2 decades now.
Yes.
It is safe, it is effective, and it is a very important part of the work that we do, very important to our patients. And now you have folks that are trying to take a look at it 2 decades later and say it was inappropriately approved. So we're waiting on the ruling from the judge in Texas to see how that turns out.
That's terrifying.
It is terrifying. It's terrifying to once again be back where in the hands of judges and politicians trying to make decisions that should be talked about between medical providers and patients.
Yes. Well, I'm wearing my bands off our bodies button because, folks should not be getting involved in our personal healthcare decisions. That's when correct. And whether to have children. So I'm sorry that I was imprecise. So Plan B, the morning after pill, is an oops. It's a sexual assault versus your and that's to prevent a pregnancy, prevent implantation, prevent fertilization. And mifepristone is after there is a pregnancy, another method of terminating a pregnancy.
That is correct.
And they are both safe,
legal, available. You can get Plan B, emergency contraception, in your pharmacies. You can call us if you need help with pregnancy options. And one of those options, of course, is to use of mifepristone, a medication abortion.
So you just referenced pharmacies. Mm-hmm. Not every pharmacist is willing to dispense, and that's become an issue in some places. Is that a battle that you're fighting in Maryland, or is that a battle that others are dealing with?
So you mainly see that in other states. However, we do hear about it in the state of Maryland, and we are constantly checking in with pharmacies. I know when I go to the pharmacy, I just kind of make small talk and see how folks are handling, how the pharmacists there are handling emergency contraception. By far and wide, you see see it available here in Maryland. But that is not without lots of advocacy by you and all of your colleagues, and to ensure that that is the case here in Maryland.
Right. So let's go back to the Dobbs decision. So there must have been an overnight reaction in fundraising, certainly press attention, women. So I went down that day. What did I just do with it? Hold on. I went down to the Supreme Court that day, as a lot of us did. And I had a two-sided sign. I don't know if you can see it.
Yep. Now and always, our bodies, our choice.
And then on the other side,
Maryland proudly pro-choice. Love it.
That's what I did. And there were a lot of us down there that day, but you feel pretty powerless. So you have some power here. So what did you do that day and in the days to follow?
So we definitely lifted our voices across the state, from Ocean City to Baltimore, and then, of course, down in DC, to express outrage, but also to remind people that you can receive this care here in Maryland. Every time something happens nationally, we have to go back and make sure that our patients understand what is and is not available here in Maryland, because it gets confusing. You watch the national news, you see, everything on Twitter, on social media, and of course, people in states where there's bans are rightly so upset. And a lot of times people, you're a patient who doesn't, isn't paying attention to politics every single day, because people live their lives,
right,
but they need healthcare, and then they're confused about what's available. So our staff do a very good job of patient education and reassuring patients.
So in addition to Maryland women, Planned Parenthood clinics are now being contacted by women from other states where there are restrictions or bans. How are they dealing with what is likely a deluge? I mean, how are they managing?
Yeah. So we're on track to see about 20% more patients than we did pre-Dobbs. About 10% of them are from out of state. So, we were preparing for everything prior to Dobbs, and, floodgates to trickles of patients coming through, and it's kind of in the middle. And it really has to do with where abortion is available in the rest of the country. So, we have 18 states that have bans on abortion care. And on the East Coast, now, a lot of that is, the center of the country and the South.
And to be clear, that's 18 states where the government or the courts, the legislature or the courts, have deprived women of the right to decide.
That's right.
Make healthcare choices themselves.
That's correct. 18 states where women have to travel out of their hometowns to receive healthcare. Why should you and I have a different availability of a medical procedure? Because we live in Maryland, why should that be different, from someone who lives in Mississippi or Ohio or Texas?
Right.
I mean,
so they're dealing with an influx, so about 20% more. At some point, might more clinics open? Are they expanding hours? Are they hiring staff? How are they making sure that women get timely, friendly, professional, efficient reproductive health care?
Well, across the country, what we're doing is making sure that all of our navigation networks are connected together. And we've been working on that for years as a preventative measure. So, or in anticipation of Roe being threatened. Unfortunately, it came true, but we had the networks already put together. Of course, there was some bumpy roads at the beginning, but all of us are talking to each other. And the link pins and kind of the saviors of all of this are the abortion funds. So we have in Maryland, we have the DC Abortion Fund, and we also have the Baltimore Abortion Fund. They work very hard on getting patients from out of state to providers here in Maryland. So we work closely with them, and we work closely with our sister agencies across the entire country. Planned Parenthood Federation took a big role in ensuring that those networks were being set up.
So if a lower income woman from another state needed to come to Maryland for an
Mhm.
abortion, talk about how that would work, how she would get in touch, and if someone wanted to donate to support that effort, if you can speak to both that.
Sure. She could call us directly, call Planned Parenthood directly, go to the Planned Parenthood website, just plannedparenthood.org, and all the links are there. She can call the Maryland facilities directly, or she can get linked into the Baltimore Abortion Fund, and they will help them find a provider. That it could be us, it could be another provider that is that has appointments available.
Mhm.
All of us have access to abortion funds to help those who cannot pay for their care. So in Maryland, if you're, Medicaid and insurance will pay for it. If you are uninsured, we will definitely, we have a self-pay program, and we can definitely help you to find the additional funds that are needed to receive the care.
So timeliness matters. It's not like a mammogram when we all should be doing this every year and taking care of ourselves. But if it's in April versus March, the world doesn't end. With abortion care, it really is,
Yeah.
there's a time sensitivity to it.
That's right.
And yet women have jobs, they need childcare, they need to travel.
Mm-hmm.
That's a lot of staff time for you all to help them navigate getting to Maryland and getting the care and getting an appointment.
Yeah. On one hand, it's very how do I put it? Some days I wake up and I say, I just want to provide healthcare today. I
Yeah.
don't, one day I just want to wake up and provide healthcare and not have to be fighting for this availability and, jumping through a million hoops to get
Yeah.
healthcare.
Yes. Yes. Well, let's talk about this year, the 2023 legislative package. There's several bills. Why don't you talk through what they would do and why they're so important?
Okay. First and foremost, we have legislation that would create a constitutional amendment that would be voted on in 2024. The Speaker, Adrian Jones, and our Senate President have proudly supported these and introduced these into the Maryland General Assembly. So what happens is that the Maryland General Assembly passes the availability to have an amendment that will then go in front of the Maryland voters, just like it did in 1992.
Right.
It, go in front of the voters and enshrine abortion care in the state constitution.
So there are people who say, why are we putting abortion in the Constitution?
Mm-hmm.
What's the answer to that?
I would say, on the very general terms, look around what's going on in the rest of this country. This is the highest level of protection for women's health care that can possibly be. So we are proudly supporting this. We are very much behind this in support. Look at Dobbs. We used to be okay here in Maryland because it was in the state statute to that abortion care was legal, but we also had a layer of federal protection with Roe v. Wade.
Yep.
Now that's gone.
No longer.
So,
okay, so let's go back. So the constitutional amendment, that's one, but that's not the only bill that is before us this year.
There's a shielding bill that helps protect providers who provide care to those who come from out of state, because there are many states that are looking to they're not satisfied with just having a ban in their state. Now they're trying to go after providers who provide care to their constituents in a state where abortion is legal. So Maryland General Assembly is going to say, no,
right.
This is legal here. And we are going to protect our providers. We will not participate in any extradition or prosecution against providers who provide care here.
Yep.
And then the next piece of legislation helps to protect our patients through their electronic medical records.
Huge.
So because
Huge.
parents are concerned.
Yeah.
If they come from another state, or you go to another state, you move to another state, your health record
Right.
follows you,
Right.
as you know, through electronic health records. So what this bill will do will not allow the health record to be crossed state lines
Right.
for abortion care. So if you come in, have abortion care, you're from another state, you can keep it private through your electronic health record. You can, it's your choice. You can keep it within your electronic health record, but this protects you when you return to a state that has a ban.
Yes. And then there's the bill that makes contraception more available and college
Yes.
campuses. There's so many other
Yes.
pieces a lot of us have been looking at and supporting.
Yes,
a
and I
lot of that.
appreciate that, all of that support. Our patients appreciate that
Yeah.
support. And college campuses, I mean, we see patients all the time, as you can imagine, from college campuses, see them, or we can on our telemedicine visits, see them sitting in the dorm rooms.
Yeah.
And this bill, the last bill, the education bill, will require that the public universities have a plan to either provide or refer
Yes.
for birth control and abortion care.
Yes, yes, huge. I have a lot of other questions. Let's see. There's a lot of disinformation out there. So let's just talk about the public and what the public is hearing. And you talked about the media and all that. What's a website that you recommend that has the facts about abortion care that you recommend?
I would say use PlannedParenthood.org. It is the most visited website for sexuality education. And if you get on our website, it gets millions of hits a month. And that's from users of our services. That's for people doing research. That is for parents. It is widely the most visited website by parents, because parents need to know how to talk to their kids. Absolutely. And they want the facts. So It is the premier website.
Good. Language. Earlier, you said anti-choice, which is what I say, pro-choice and anti-choice. And then after Dobbs, it was suggested that we not just say choice, but that we have to be very clear. We're talking about abortion and reproductive rights and all that. So talk about language and how important that is on this issue.
I mean, language is important, and language can be stigmatizing. So we talk about choice, but really we're talking about options, and we're talking about decisions that a person is making about their pregnancy. And those are decisions should be made between a patient and their doctor and their own support system and whoever they want to pull in, but they don't want to pull you in. They don't want to, they don't want to, and that is, and that's the truth. So yes, we have to look at language. It can be stigmatizing, but so many people have had abortions and they're talking about it. And it is becoming, normalized, for lack of a better word. And a part of, we say abortion is healthcare. Healthcare is a human right. And we just have to keep saying that over and over.
Right. When I worked at National NARAL, I think you know that in the mid-'80s, I worked at the National Abortion Rights Action League at the national office, and I was doing the political and the legislative stuff. And we organized a speak out, and we had women from around the country come to DC. And on Freedom Plaza, we had, now I can't remember, 2 days of women reading letters and telling their stories. And it was so powerful. And it was legal and illegal. It was failed contraception. It was rape. It was so many different aspects. And it reflected the true range of women's lives.
We see every type of patient, every story that you can imagine. We see difficult decisions. We see pragmatic decisions. We see people people walk in the door, they know what their plan is. People walk in the door, want counseling, married, unmarried, children, no children.
Right.
It runs the gamut. But the most important thing is that the people that we see make their own decision.
That's right. That's right. How do you deal with the trolls, with the ugliness?
Yeah. Yeah. Well, I've been dealing with it for 30 years.
Yeah.
We
Bless
have
you.
protesters out in front of our office every day. Our patients and our staff have to walk by them and hear names, that be called names. I'm called names every day in Baltimore. And it, in some ways, those of us who work there, we get numb to it, which is it's a mechanism for us to be able to keep going to work. But it can be frightening and scary for a patient to walk in and think that, I'm coming in for birth control, I'm coming in to get a health exam today, and what's this crowd, and why are they telling me things or showing me ugly pictures?
Right.
So it is infuriating on behalf of our patients that they're there.
Well, the names you should be called are Shiro or hero and leader and advocate and CEO. And so on a happier thing, we have a lot of coalition partners, we, the pro-choice community. Talk about, have there been new coalition partners, more folks who are getting engaged that didn't used to be, again, in a post-Dobbs Supreme Court decision world?
Well, we've always had a really wide range of support, and in the progressive movement, of course, we have lots of support here in Maryland. And again, I think that Dobbs really got not just kind of the vocal support, but got the real hands-on, let's coordinate, let's collaborate, the work between abortion providers across the state and the work between the abortion funds. You're seeing the real pragmatic, real hands-on stuff that matters to patients, stuff that makes a difference happening.
Do you want to be specific about coalition partners? I mean, for instance, in the faith community, there are certainly faith partners. We always
yes. So we've always had a religious coalition that has stood behind us, and people that will come out and testify at the hearings, etc. And here's what I always say about the religious community. This is a group, they know the most. Let me just say this, because they have thought through it. And they have thought through every side, and they've seen every side, and they've counseled people.
They're congregants or parishioners.
Yes.
Yep.
Yes. So they really come from a different place and a different place of thought and consideration. And so I think I love it when we have support from the religious community.
Yes. Just a couple of quick questions before we go to the Fast Five. One, what is your biggest challenge that you're facing? If you had a magic wand, what would you want to have?
I mean, it would be funding. We live so close to the margin because we try to take any funds and turn it right back into patient care. So, we're constantly doing work that is right in front of our face, and the work that seems urgent. And I would, as a CEO and running an organization, finding the means to expand and get further out. We are so lucky to have a supportive community, and so lucky to have generous donors to help us to do that work.
That was a good puffball for you, wasn't it? And let me just honor a former Senate colleague, Dolores Kelly, because you set up a Senator Dolores Kelly fund at Planned Parenthood last year, and that was to honor her and provide care. Last question. Someone wants to give their time either instead of or in addition to their money. What could someone at the grassroots do to support Planned Parenthood?
Oh, that is a great question. We are always working with volunteers. We always need volunteers, especially this time of year during the Maryland General Assembly when we're advocating for bills. And in fact, tonight we have a gender justice rally out on Lawyers Mall, out in Annapolis. So please join us if volunteers.
Unfortunately, yeah, this won't be posted in time, but
Well, there'll be
there will
more.
certainly be others.
There certainly be more. There always are. So,
Yes.
And you can, again, if you go on the PlannedParenthood.org website, link into Planned Parenthood of Maryland, there's places to sign up.
Perfect. Well, Karen Nelson, it has been so great to chat with you. And now it's time for the fast five quick questions to let people learn a little bit more about you. So question number one, you read a lot. Do you have a favorite book?
Oh my gosh, I'm reading Daisy Jones and the Six right now. I know that that's really hot. I love Ann Patchett. I love to read.
Nice. Question two, what is your favorite junk food?
Pretzels.
Okay, that's pretty.
Put a little crab on it.
There you go. There you go. Question three, you've got a really stressful job. What makes you laugh?
Oh my gosh. Well, first of all, we laugh at work. I mean, you have to have great coworkers, and we have some fun in my office. It's hard work and it's emotional, but we do have some fun.
Good. I'm glad to hear that. Question four, if neither time nor money nor COVID nor whatever were an object, where in the world would you want to travel?
Ocean City, Maryland. I'm not kidding. It's my happy place.
Okay. All right. And the fifth question, the question that I ask all of my guests, Karen Nelson, President and CEO of Planned Parenthood of Maryland. What is your hidden secret superpower? What is a skill or talent you have, something you're really good at that most folks can't do?
I can stay pretty calm. I can stay pretty calm and cool in a crisis.
That's huge. That's important. All right. Well, what a pleasure to talk to you. And thank you on behalf of all of the women of Maryland and in states facing abortion bans. Thank you for your leadership, your advocacy, for the untold hours and stress that you invest in your job. We are so grateful to you. And thank you for taking time to chat today.
Thank you. I really appreciate all of your support and friendship. And it's so great to have you on our side.
Thank you. Thanks. I'll see you very soon.
Bye-bye.
Bye. Take care.